you doing today? My name's Elena. I'm going to be the nurse practitioner student that's going to be doing your ear, nose, and throat assessment. So I'm just going to go ahead and do my hand hygiene. I'm going to start by inspecting like your face and your hair just to make sure that you don't have anything abnormal going on. Can you smile for me? I can see that you don't have like any asymmetry going on. I'm just going to take a look at your scalp to make sure you don't have any lesions or any issues in your hairline. You have a good hair growth, good hairline, nothing abnormal. Everything feels within normal limits. I'm going to go ahead and look at your skin. Your skin has a really good color, good blood flow. I'm going to be checking your visual acuity right now. So I'm going to have you go ahead and read off this paper for me.
PMHNP.
Okay, and can you go ahead and close your right eye, please? Like hand over your right eye and read it again.
PMHNP.
Okay, and then do the same thing with your other eye.
PMHNP.
Okay, good job. Okay, so now I'm just going to be checking like your field screening. So I'm gonna look at me. I'm gonna have my hands and kind of like wiggle them, and I want you to let me know whenever you see my fingers, okay?
See them.
Okay, can you go ahead and close this eye for me? Cover it, okay, and then let me know when you see them.
See it.
Okay, and close that eye for me. And let me know when you see it.
See it.
Okay, great job. Okay, so now I'm just gonna be looking at your eyes. I can see that you don't have any issues going on. Have you had any swelling or drainage recently you want me to be aware of?
No.
I'm gonna go ahead and kind of tip your eyelids forward and just look in. I can see that your tear ducts look look normal, and I'm not really worried about anything there. I can see that like everything's within intact the way that it should be. Now I'm gonna go ahead and shine a light in your eye and just make sure that your lenses and your cornea and everything looks normal. Let me just turn on my light. Okay, I'm just gonna stand right here, and from the side, look in, just look straight ahead. Okay, everything looks normal there. Okay, and everything looks normal there. So now what I want you to do is I want you to look at my finger and then look in the distance, because I want to see if your pupils are reactive to accommodation. So go ahead and look right here, and when I tell you to look there, look in the distance at the back wall. Okay? Now look at the back wall, and look at my finger, and now look at the back wall. Okay, very good. Your pupils are constricting, which is what we want. Whenever I was shining the light in your eye, I could also see that your pupils were reactive to the light, which is what we want, so that's all normal. Now the next thing that we need to do is, what I want you to do is I want to check the extraocular movements of your eye, so I want you to follow my finger with your eyes. Okay, very good. No, nothing abnormal there. Now I'm going to be looking into your eye with my, okay, and now I'm just going to be looking in, making sure everything looks normal. I'm going to look at this eye first. So I'm going to go ahead and, no, you keep your eye down. I'm going to go ahead and look in, okay? Open. Okay, everything looks normal there. Okay, now I'm going to go ahead and look into this eye as well. All right, and everything looks normal there. Your optic disc and everything is within normal limits, and there's no swelling or edema that I'm really worried about. Now I'm going to be looking at your ears. I can see that they're symmetrical. Turn this way. There's no lesions or anything that I would be worried about. Now I'm going to look into your ear just to make sure. Pull this back. Okay, everything looks good and pearly, and I'm just going to be doing the same thing on this ear. I'm going to be pulling your ear back and looking in your ear. Okay, nothing abnormal there. All right, so Now I'm gonna be doing your Weber and Ryan test. So what that is I'm gonna bang this tool and I'm gonna put it on the top of your head, and I want you to let me know which side of your ear you hear it more on, or if you hear it equally. Do you feel like you feel it equally?
Yeah.
Okay, so now what I'm gonna do is I'm gonna bang my tool again, and I'm gonna put this behind your ear, and I want you to let me know whenever you can no longer hear it anymore, okay? And then I'm gonna put it right against your ear, and then I want you to let me know when you can hear it and when you stop hearing it. Does that make sense?
Mm-hmm. Okay.
Okay, can you hear it?
Yeah.
Let me know when you can.
Okay.
Okay, all right, I'm gonna do the same thing to the other side, okay? You can't hear it?
Mm-mm.
Can you hear it now?
Mm-mm.
Okay. All right. So everything's normal there. I'm just gonna look at your nose, make sure that everything's symmetrical, that you don't have any tenderness, which everything feels okay. I'm gonna look inside and look at your septum and make sure that you don't have any like deviation, which with my light I can see that there's no swelling or anything abnormal in there, and your septum is intact. Can you open your mouth for me? I just want to take a look at everything in there. I can see that your hard palate looks great. I can see your soft palate. Have you had any issues with your teeth or any loose teeth or cavities? Will you look at me, and will you lift your tongue so that I can see? I just want to make sure that you don't have anything abnormal in there. I can see that your mouth is moist. Have you had any like ulcers or anything in your mouth? Anything go on there?
Mm-hmm.
Your tongue's moist. Everything's intact. Your gums look great. Now I want to go ahead and feel your TMJ. So go ahead and go like this, side to side, and then up and down. Okay, no clicking or anything abnormal, and any discomfort? No? Okay, so now I'm gonna go ahead and look at your neck. I can make sure that everything's symmetrical there. Let me feel for your thyroid gland, okay? Feel that everything's midline. Will you swallow for me? Can you put your chin to your chest? I just wanna see. And then go back, and then side to side like this. Okay, any issues there? Anything uncomfortable? Now I'm just gonna palpate your sinuses right here. Do you feel like any drainage or anything? Okay, now I'm gonna feel your lymph nodes. And under here. Any swelling or discomfort? Okay,
No.
now in the back. And now in here. Can you kind of put your clavicles forward? Okay, I don't feel any masses or anything I'm concerned about. I'm just gonna feel some of your muscles back here. Is anything tender or anything bothering you?
No.
If your thyroid gland was a little swollen, or if I would have felt it, I probably would have checked for a bruit, but it wasn't. Everything felt normal to me. Now, do you have any questions for me or anything that you would like me to know or be aware of?
No.
Okay, all right.